Psychiatric interviewing techniques. Psychiatric interviewing techniques is the foundation of a diagnosis and treatment in mental health. Unlike many other medical specialties, psychiatric diagnosis depending primarily on the clinical interview rather than laboratory testing or imaging. A skilled interview builds rapport, elicits accurate information, assess safety, and guideline evidence-based treatment. By end of this video, you should be able to establish therapeutic rapport. Conduct a complete psychiatric interview. Use effective communication techniques. Obtain comprehensive psychiatric history. Perform mental health status examination during the interview. Assess suicidal and violent risks. Adapt interview techniques for different populations and avoid common interview errors. The goal of psychiatric interview is the psychiatric interview has several purposes. Establish therapeutic alliance. One of the goals is to establish therapeutic alliance. Other goal is to gather diagnosis information, assess current symptoms, evaluate functioning, identify strength and protective factors, assess immediate risk factors or safety risk, develop treatment plan. A successful interview is both patient-centered, which is building a trust, and clinical directed to obtain information needed for diagnosis and treatment. So the goal of psychiatric interview is to conduct a successful interview that is patient-centered and clinical directed to obtain the information needed for diagnosis and treatment. So psychiatric interview has different phases. First phase is the preparation. Before meeting the patient, you want to prepare, review available record. You want to understand the reason for the referral. You want to ensure the privacy and quiet environment. You want to conduct the interview in a quiet environment. You want to minimize the interruption. Be aware of your own bias and emotional response. Second, you want to introduce yourself and your role. What is your title? Hello, I am John. I am a psychiatric. I like to talk with you today about what was been going on and how we can help you. Example will be purpose of the interview, expectation duration, how long this interview will continue, confidentiality, and limitations, because confidentiality has limitations, such as risk of harm to self and others, abuse reporting requirements, and you want to encourage the patient to have questions. You want to establish a report. Report is the therapeutic relationship that encourages honesty communication. Ways to build a report. You want to maintain appropriate eye contact. You want to use calm, non-judgmental tone. You want to respect personal space. You want to show empathy. You want to allow appropriate silence. You want to listen. You want to validate the emotion without necessarily agreeing with the belief. For example, that sound is incredibly difficult. That sound is incredibly difficult. That sound is incredibly difficult. Avoid arguing the patient or the person, client. Avoid interrupting. Avoid minimizing the feeling. Avoid false reassurance. Avoid argumentative. Avoid interruption. Avoid minimizing the feeling. That's okay. You don't want to say that. It's not okay for the patient. It's not okay. That's why they come here. Interruption, when they tell you something, you want to inject to yourself. No. You want to avoid that. False insurance. False reassurance. You will be okay. No, that's not accurate. Okay, so communication techniques that you want to adapt are open-ended questions. Allow the patient to describe concern in their own words. What brings you in today? Can you tell me more about your symptoms? How has this affected your daily life? You ask the question, you wait the response, you be silent. These questions generate richer information and strength report. Close-ended question is useful for clarification specific details. For example, have you ever been hospitalized for psychiatric reasons? Are you taking your medication every day? Do you have thoughts of hurting yourself or others? Use close-ended questions after open-ended explanation. So let's say you ask them open question and they answer that question. You give them time, they explain all the details, and then you will answer. You will ask them closed question. So open the discussion with open question, give them the time to explain, and then close question is in the end to close the session. Not to close the session, to get the details that you wanted from their explanation. You want to guide the interview. You want to ask them what you need from there. The specific topic that you want to get to. They've been explaining what happened, because you ask them open question and they are giving you details. Then you ask close question, give them time, close question, give them time. Then you do the reflection. Restate and paraphrase what the patient said to show that you understand what they are telling you. I feel like everyone is against me. Example, that's what they say. Clinicians will say, it sounds like you have been feeling isolated and unsupported. You want to clarify, ask for additional details when information is unclear. For example, when you say you feel out of control, what does that mean? You want to summarize what they tell you, or key points. Periodically summarize the key points. Periodically. So far, you have described increased anxiety over the past month, difficulty sleeping, frequent panic attacks that are interfering with your work. That's how you want to summarize what they tell you. Summarizing helps confirm an accurate and transition between the topics. Silent. You want to be silent when they are talking. And purpose of a silence gives the patient the time to think. Often encourage deeper disclosure. Resist the urge to fill every pause. Active listening. Active listening involves giving full attention to the patient. Avoid interruption. Absorb verbal and non-verbal clues. Reflecting and clarification. Showing empathy. So active listening indicates empathy. Clarify. You want to clarify and reflect what they prescribe. Non-verbal communication include grooming. You want to observe the grooming, hygiene, eye contact, facial expression, posture, psychomotor activity. When you are actively listening, you want to also observe hand gestures, personal space, emotional. Non-verbal behavior can provide important diagnosis clues. Psychiatric history. You want to do the psychiatric history, a comprehensive psychiatric interview that include the chief compliant history of present illness, past psychiatric history, substance usage history, medical history, current medication, allergy, family, psychiatric history, social history, developmental history, trauma history, review of systems, present illness include the onset, duration, severity of the symptoms, frequency, course of the symptoms, trigger, association symptoms, functional impairment, previous treatment they have. You want to use all the cards memory. All the is the onset, location of the symptoms, duration of symptoms, characteristic of the symptoms, agitation or aggravation factors, relief factors, time that it began or how long it been happening, severity of the symptoms, all the cards. Then you want to assess mental status examination during the interview. Observe and document the appearance, behavior, mood, speech, affect, thought, content, thought process, perception, their cognition, insight, and judgment. Many elements of the mental status examination are assessment continuously through the interview rather than a single point in time. So because you are interviewing, you want to do that. You want to observe. You want to assess suicidal ideation. Every psychiatric interview includes assessment of suicidal ideation. Ask directly, have you been had thoughts that life is not worth living? Have you had thoughts of hurting yourself? Do you have any plan? Do you intend to act on those thoughts? Do you have access to means? Assess previous attempt, protective factors, substance usage, recent stress, asking about the suicidal ideation that not increase a suicidal behavior. You want to assess violence. Assess thought of harming others, previous violent behavior, access to means to hurt others, demand hallucination, impulsiveness, substance usage. You want to also interview trauma-informed interviewing. Assume that many patients have experienced trauma. You want to assume that. So the principles include prioritize emotional and physical safety, explain procedure before begin, ask permission before discussing sensitive topics, avoid forced disclosure, avoid forcing disclosure, Empower patient through collaboration and choice. Cultural consideration. Cultural identity, language, preferences, religion and spiritual beliefs, family structure, healthy beliefs, traditional healing practice, avoid assumption or stereotypes. There is an interview for special population like children, elderly, parents. Children, when you want to interview children, you use age-appropriate language, include caregivers while asking the questions directly to the child, observe play and behavior, assess developmental milestone. Older adults, speak clearly, allow extra time for response, screen for hearing and vision impairment, assess cognitive decline, review medication carefully. Parent with psychosis, remain calm. Patient with psychosis, you want to remain calm and non-confrontal. Do not argue about the delusion. Focus on the patient emotion, experience, assess safety. Instead of saying, this is not real, they are having a psychosis, so don't say this is not real. You can say, I understand that this experience feels very real to you. Patient with mania, you want to assist patient with mania, use a brief, clear question. Set respectful limitations. Direct when needed. Assist judgment, patient judgment, impulsiveness, and sleep. Challenging interview situations include angry patient, crying patient, silent patient, highly talkative patient. So, if you have an angry patient, you want to remain calm. You don't want to escalate the situation, so you want to calm, maintain the safety distance because they are angry, acknowledge their emotional outbursts, avoid power struggle. If the patient is crying, allow time for emotional, offer tissue, use empathy statement, avoid rush to fix the problem. If you have a silent patient, allow a therapeutic silence. Ask a gentle, open question. Avoid excessive pressure. Talkative patient, redirect respectfully. For example, I appreciate that information. I like to return to what you mentioned earlier about your sleep. What are the common interview mistakes to avoid? The common mistakes to avoid is interrupting the patient too early, asking too many questions at once, lean questions, judgmental languages, premature diagnosis conclusions, ignoring non-verbal clues, failure to assess the safety. Those are the mistakes. Therapeutic alliance. A strong therapeutic alliance is associated with better treatment compliance, greater patient satisfaction, improved clinical outcome, low rate of treatment dropout, build the alliance through empathy, respect, collaboration with the patient, transparency, shared decision making. Begin with open-ended questions when use focused questions to clarify details. So focused question or closed question you want to use to clarify details, but you want to begin with the open-ended question. Listen more than speaking. Patients often provide their diagnosis if given the opportunity. If you give the patient an opportunity and they provide the diagnosis, they solve the issue. So you want to give them the time to explain what is happening to them. Observe non-verbal behavior through the interview, throughout the interview. It is part of the mental status examination. You want to ask it directly about the suicidal and violence behavior when indicated. Clear question improves assessment, do not increase the risk. Avoid emotions without reinforcing delusion or inaccurate beliefs. Adapt your communication style to the patient stage, to the patient age, culture, cognitive ability, and current psychiatric symptoms. Adapt your communication style. So it depends the communication style that you want to use based on the patient age, culture, cognitive ability, and the current psychiatric symptoms they are having. I have a question in the end. Which interview technique is the most effective for establishing a report at the beginning of the psychiatric interview? Beginning with the open-ended questions such as, what brings you here today? A patient states, everyone at work is against me. What is the most therapeutic response? What would you say? It sounded like you have been feeling isolated and unsupported. Yes. Which statement about the suicidal ideation is a correct one? Every comprehensive psychiatric interview should include assessment of a suicidal ideation. You want to memorize the rapport. R A P P O R T. Report. Remember the key element of the effective psychiatric interview as a rapid report. RAPPORT. Rapid stands for respect and report. Active listening. Patient-centered questions. Starting with open-ended questions. Perception, you want to assess the perception, mood, thoughts. For them, you want to use that mental status examination. Observe verbal and non-verbal clues. Observe verbal and non-verbal behavior and clues. Risky, the R is the risky assessment. Risky assessment include suicidal ideation, violent risk, substance usage withdrawal and risks, treatment plan through the collaboration with the patient. Successful psychiatric interview is not simply gathering information. It is the beginning of the therapeutic relationship and the foundation of an accurate diagnosis, safety care, and effective treatment. Thank you for joining me today. Please subscribe and join me again. Thank you.